Hi, everyone. Welcome to the Dental Medical Convergence webinar. Today, we're discussing 3 ways to improve your oral hygiene routine. My name is Ashley Billings. I'm with Axia Public Relations, and I am joined by Dr. Chuck Reinertson. Dr. Chuck, thank you so much for being with us today.
My pleasure. Thank you.
Dr. Chuck, will you take a moment to tell our audience a little bit about your background?
Sure. I've been practicing dentistry a little over 40 years, and there have been many, many changes over these years. And one of the main things that we found is just how important oral health is, not just for your teeth and your gums, but for your whole body. So one of the reasons we want you to understand why you need to keep your mouth good and healthy doesn't have anything to do with your teeth. It has to do with your heart. So we'll talk about that.
Thank you, Dr. Chuck. Let's get started on our webinar today. Let's go to tip 1 of our 3 ways to improve your oral hygiene routine. Dr. Chuck, why don't you walk us through your first tip?
Well, first you need to decide your why. Why do you want to take care of your teeth? Why do you want a healthy mouth? Why do you want to do these things? One of the things that would be good to do is possibly, let's rename our mouth. It's not a mouth, it's the front door to the body. And if we can look at our mouth in a different way, you want a clean front door at your house, don't you?
Oh, yeah.
Yeah. And it's the same thing. We want a clean front door to the body. But why do we want to have it good and clean? Well, people have different reasons. One of the reasons could be your health. They've shown that 50% of heart attacks come from dental infections. 90% of dental infections have no pain. And today, most physicians don't ask you about your mouth. So knowing your health reasons could be some of the motivation that you need for keeping your teeth clean. Why is that? Well, you have the heart issues, you have diabetic complications, you have pneumonia. When you have bacteria in the mouth, it hitches a ride on water vapor, goes right into the lungs. I mean, there's a lot of things medically that affect you, and that could be your why for doing that. Another reason you might want to keep a good, healthy mouth and take care of your teeth is you don't like going to the dentist. You want to avoid the dentist, and that's perfectly fine. I would just as soon have somebody pay money for their family, spend the money at home rather than the dental office. And if you can really do a great job at home, that's exactly what you can do. Saving money is a big deal. Dental care is not expensive. Dental neglect is very expensive. And that's why we want to show and help you how you cannot neglect your teeth so that you can save a lot of that money. Sometimes people are looking for a nicer smile. And certainly when you smile and you have broccoli in between your teeth, that kind of is distracting. But you want to have good, clean teeth for cosmetics. You want that nice smile. Fresh breath. Oh, my goodness. The number 1 reason for bad breath is gum disease, periodontal disease. And there's no pain with that. You don't even know what's going on. You may have a close friend or something that tells you, ooh, you got to take care of your mouth. Well, nothing hurts and you don't know it. What is that? You're smell deaf or you don't notice your own smells. And that can happen with bad breath. You might want to avoid that by taking good care of your teeth. And sometimes you want to please someone. You want to please the dentist. You want to please your spouse. You want to please someone else. That's probably one of the worst whys, because that motivation is going to go away after a while. You need to do it for yourself, not for somebody else. So those are the whys that I think we need to ask ourselves. Why do we want to do this? Why do we want to spend time taking care of our teeth? So again, is it for health reasons? Is it for avoiding the dentist? You want to save money? Do you want to look better? You want fresher breath? Or is it because you're just trying to please somebody else?
So figure out your motivation before you get started today.
Yeah, figure out your why. Why do you want a clean front door?
Thank you for the first tip. Let's move on to the next one, Dr. Chuck. There we go. And here we are at the learn your oral hygiene techniques. Can you tell us about this tip?
What techniques do we have? Well, everybody says brush your teeth, brush your teeth, brush your teeth. I think we need to throw that term out the door. Brushing only gets part of the teeth. We need to clean our teeth. Cleaning our teeth includes where a brush can get, where possibly dental floss can get, where possibly directed water irrigation can get, where possibly those little proxy brushes, the ones that go right in between the teeth, they can go. There's a lot of different techniques that we have. So the idea is not just to brush your teeth, but to thoroughly clean your teeth. One of the things we try and explain to patients is what causes cavities and gum disease. And I'll make it short. In order to have a cavity or gum disease, it takes three things. It takes a tooth, food, and bacteria. If you remove the tooth, no more cavity or gum disease, but no more tooth either. Take away the food, no more cavity or gum disease, but we die. We need the food to live on. If you take away the bacteria, no more cavity or gum disease. Well, why is that? When you and I eat food, we have byproducts. We poop and we pee. Well, when bacteria eats food, it also has byproducts. And one of those is lactic acid. When bacteria sticks to the teeth, we give it a name. That's called plaque. So you have the plaque stuck to the teeth, eating foods that we eat, and sugars are worse, but still eating the food, dumping acid on the tooth, giving you cavities or gum disease. So the way you eliminate cavities or gum disease is we don't want to take the tooth out, and we still have to eat. So number three is we have to remove the bacteria stuck to the teeth, the plaque, and that's where oral hygiene comes in. That's why it's so important to get the bacteria off of your teeth so you don't have the acids going on to the teeth. There are different techniques for doing it. There's an electric toothbrush or a manual toothbrush. You can use either one of them. I'm not hung up on how you do it. I'm hung up on the results that you get. A manual toothbrush works fine. It just takes a lot longer. An electric toothbrush, I was arguing for many years that you can do just as good a job with a manual as you can an electric. But after looking in mouths for a long time, what I've learned is that patients that use an electric toothbrush overall do a much better job thoroughly cleaning their teeth than those that use a manual toothbrush. So use the toothbrush. My recommendation with an electric toothbrush is 2 minutes on the top teeth, 2 minutes on the bottom teeth. So there's 4 minutes right there. You can't just do a lick and a promise. And if you've ever taken your car through a car wash, you know how slow those rollers go right next to the car. That's how you use an electric toothbrush. Barely move it. Just let it do its job. Don't go back and forth with it. Just barely move that toothbrush and take your time. Again, 2 minutes on the top teeth, 2 minutes on the bottom teeth. And then when you're finished with the toothbrush, I like directed water irrigation. You can use a shower breeze that you do in the shower. You can use a water pick that you do next to the sink. But you want to use as warm of water as you can comfortably tolerate. Don't burn yourself. You put it all the way on high, and you want to aim the water directly in between the teeth to where the floss would go. But you leave it in that position for a minimum of 5 full seconds, which is 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. Then move to the next space. Don't go along the gum line, just in between. Start the back of the last tooth. 5 seconds there, move to the next space. 5 seconds there, move to the next space. 5 seconds there, all the way top and bottom teeth. You don't have to go from the inside out, just from the outside in. That's one way of doing it. They also have these nice little tiny brushes that can fit in between your teeth and clean using those. They're called proxy brushes. You can use that. That's wonderful. If you're using dental floss, you want to find out, are you flossing or are you popping? Most people don't floss. Most people pop. Popping is you pop the floss in between the teeth, you wiggle around a little bit, you take it out, you go to the next one, you wiggle around a little bit, take it out. That's popping. Flossing is you go in between the teeth, you wrap the floss 180 degrees around one of those two teeth, you hug the tooth and slide that floss up and down 5 or 6 times. Then you wrap it around the other tooth, slide it up and down 5 or 6 times. You want to really wrap that whole thing so that you can get the floss touching more of the tooth surface, so you can get the bacteria off, which we already know causes cavities and gum disease. So if we can get that off, then we're going to be much healthier. And it's going to take you a little bit of time to do that. I would much rather see somebody spend 8 to 10 minutes one time a day thoroughly cleaning your teeth than doing a halfway job 2 or 3 times a day. So I brush my teeth 3 times a day. Well, how do you clean in between? Oh, I brush. Well, the brush isn't going to get in between your teeth. Oh, I have an electric brush. No, an electric toothbrush isn't going to get in between your teeth either. You have to find some way of getting that cleaned out. Again, I'm not hung up on how you do it. The whole object is to remove the bacteria, the plaque from your teeth without damaging the tooth or the gums. There's more than one right way and there's a whole lot of wrong ways. So there are some techniques. It takes a little bit of practice. Personally, I don't floss that often, but I use directed water irrigation every day. So those are some techniques you can do. It takes practice, just like anything. It takes practice. When you get good at it, you might get it down to 7 minutes, but you're not going to get it down to 3 minutes. So those are some techniques I think everybody can use, and they're very inexpensive.
Okay, thank you, Dr. Chuck. Let's go to our third tip for ways to improve your oral hygiene routine. This is add to the existing routine. Tell us about these tips, and I'll click through our different slides as you speak about each point.
Sure. We all have habits. We have routines. When you get up in the morning, a lot of times people have the same routine. You get out of bed, you put your glasses on if you need to see where you're going. You put your feet on the floor. You maybe go into the bathroom. But eventually you're going to either take a shower or wash up. And a lot of people brush their teeth in the morning. Well, to look for some kind of a trigger for flossing, you need some type of a reminder. What's your trigger? What's going to remind you to do that every day? One trick is you can actually put something on the bathroom mirror. Now, we talked about your whys earlier. You know, the whys, is it for your health, or you want to avoid the dentist, you want to save money? So put a picture on your bathroom mirror of either a healthy mouth or a bad mouth, whichever's going to trigger you. Maybe you want to put a picture of some money up in there because you want to save money. But that's your trigger. So you look at that after you brush your teeth and say, oh my gosh, I need to floss. I need to take your time doing that. So you need to find whatever's going to work this into an existing habit that you already have. It's easier to modify an existing habit than it is to make a whole new habit. So you're doing something already. Let's just add one thing to it. Now, when you're adding that one thing to it, you don't have to add everything at one time. This is why I say you can start, you hate flossing your teeth. Okay, floss just one tooth, just one. Pick one out in the front if you want, and really thoroughly clean that tooth. Clean that one tooth really good. And when you're finished cleaning that one tooth, look in the mirror and celebrate. Look, yeah, I did it. I got that one tooth. I did a great job. And the next day you might want to do 2 teeth, or maybe you just want to do 1. At some point you want to do some more teeth that you have in there. When you get in the habit of this, you don't have to think about it anymore. Then it becomes much easier, because now it becomes routine. This isn't something you have to think about. A lot of people will do it in the shower. That's personally how I do it. So every morning I take a shower. When I'm in the shower, I wash my body, I wash my hair, I shave in the shower. Then I brush my teeth with an electric toothbrush in the shower. When I'm finished with again, 2 minutes on the top, 2 minutes on the bottom. When I'm finished with that, I put my toothbrush up, I grab the shower grease, which is like water irrigation you can hook up in your shower. It's available on Amazon. You can find them easy. But then I do the 5 seconds in between each one of my teeth. It's my routine. I take the time doing that. Hang that thing up, and when I shut off the shower, I'm pretty much done. I have to, dry my hair, put on some pit juice under my arms, and I'm good to go for the day. So that's a routine. So if you can add thoroughly cleaning your teeth into one of your already existing routines, it'll become a lot easier for you.
I like how you say start small. Just concentrate on one tooth. It's like take everything one step at a time, one day at a time,
Yeah.
One tooth at a time.
One tooth at a time. That's fine. Which tooth do you want to keep?
Those front ones first.
Yeah, there you go. So you want to just take your time and don't get upset with you. If you miss a day, you miss a day. But we all have to forgive ourselves for the past. We have to look forward to the future, though. And so you can't do anything. If you go through life looking in the rear view mirror, you're not going to see what's in the windshield. So we need to look where we're going. And where we're going is to have a healthier mouth. And that's going to just take a little bit of developing our new routines or new habits. But you can do it. We all can do it.
Yes, we can. And these are great tips that you've shared with us. This was a webinar about 3 ways to improve your oral hygiene. And let's talk a little bit about your work with the Dental Medical Convergence. We are bringing you this webinar through the Dental Medical Convergence, which is a nonprofit. And Dr. Chuck, why don't you take us through who we are, what we do, and who we serve?
Well, the point is trying to help people connect the dots between the health of the mouth and the health of the rest of the body. I've tried locally to get into our hospital, and their decision was, we don't want you coming in and diagnosing things we can't treat. I said, well, every week I diagnose things I can't treat. I refer them to somebody who can treat it. Their answer, we don't want to be in the referral business. I said, okay. So I went to local physicians and talking with them, and so many of them are just so cotton picking busy. They say they don't have time to ask about the mouth. They only have so many minutes per patient, and they don't have time about the mouth. So we've decided to go directly to families, and that's what the Dental Medical Convergence mission is, to go directly to families and help them be able to connect the dots between what's going on in the mouth and the rest of the body. So many diseases, from cardiovascular disease to diabetic complications to pneumonia, pregnancy complications. They're finding oral bacteria in the brains of Alzheimer's patients. I mean, there's so many things. If you think about it, if you have an infection and you're dumping bacteria into the bloodstream, it doesn't matter if that infection is in your leg or in your mouth. You're dumping bacteria, and that's not healthy. So the whole focus of Dental Medical Convergence is, let's bring this message to the people, to the families, so you can do the things you can, beginning with the free stuff at home. Start with the free stuff, and then we can work our way into getting some of the treatment done that needs to be done. So we work with families. We work with anybody who's looking for a presentation, as far as schools, churches. We want to get the message out to just regular folks, regular people, because it's your mouth. It's not the doctor's mouth. It's not the hospital's mouth. It's your mouth, and it's your body. So, but we serve mainly the family community, but we want physicians, and it would be wonderful if hospitals would get on board and have a dentist on staff with them, so they can rule out the mouth as a source of the disease, or the bacteria that's causing the disease that they're in the hospital for.
And I'll mention that we are here in Florida, but we are trying to reach people all over America, all over the world. We want to spread this message far and wide.
Well, if you have a mouth, it's for you, really. And if you don't have a mouth, you don't have to listen. But, I tell physicians who tell me they're too busy, I say, well, is the mouth part of your body? And they're like, well, I said, if you think the mouth is not part of your body, when you go to work on Monday, leave your mouth at home.
Yeah.
You can't do it. You can't do it. So we need to include the mouth when we're looking at our overall health.
And this all has been such great information today, Dr. Chuck, and we want to tell our viewers what you can do today for a healthier tomorrow, for a healthier overall wellness. We want you to go to the patient resources page at the dentalmedicalconvergence.org. And there we have so much information, so many educational resources, not just for patients out there, not just for families, but for dentists, for medical professionals, for doctors. There is something called the PDF called 5 Questions You Should Ask Your Dentist, and we hope you will download that PDF. It is on the patient resources page. You can use that to discuss your dental health with your primary care physician. Let's really open up the communication lines. That's the goal today, correct, Dr. Chuck?
Absolutely. Now, we want to include the mouth as part of the body.
Yes, we do. Well, I appreciate everybody taking the time to listen to our tips today, and we hope that this will help you to make some improvements to what you do each day as you are taking care of your oral health, because it's something most of us are doing it. We're brushing our teeth, we're cleaning our mouth, but let's do it the right way.
Yeah. And when you do it right, celebrate. Don't be afraid to say, yeah, we did it. I did it. It's when I was a kid back in the 60s, they used to have a deep commercial where the youngster would run down the street holding a report card, yelling out, look, Mom, no cavities. Look, Mom, no cavities. And I think we need to celebrate the same way today, and just when you make an accomplishment, give yourself an attaboy. We all need that.
Yes, definitely. Well, thank you so much. Again, I am Ashley Billings. I'm with Axia Public Relations, and we are helping to spread the message that Dr. Chuck Reinertson is so passionate about the importance of oral health and how it impacts your overall health. So again, we are with the Dental Medical Convergence. You can visit our website, thedentalmedicalconvergence.org. You can email us with questions. We have an Ask Me Anything segment, which is why our email address is ama@thedentalmedicalconvergence.org. You can find us on Facebook, and we are happy to provide you with all the educational resources you need. Dr. Chuck, thank you so much too for being here today and helping us to spread this important message.
Thank you so much. Thank you very much.
Thank you to our viewers. We hope you have a wonderful day.